New efforts tonight to fight addiction and opiate overdoses. Columbus police have been carrying the opiate overdose antidote Narcan, which is also Naloxone, for a few months now.
Now the emergency funding is being put into place to help make sure that people who don't have insurance or can't afford the life-saving drug have access to it. NBC4's COURTNEY YueN joins us now with why this is needed. Courtney?
Colleen, Mike, the heroin epidemic is hitting Franklin County hard. These numbers I'm about to show you right now just came in today. From January to March. EMS people in Franklin County saw 1,033 people experiencing a drug overdose. From April until June, 1,291 people that jumped to. That's an increase of 25%. This is just part of the reason that shows why drugs like Naloxone are needed to help save lives.
I've had a lot of people come back for another dose of Narcan because the previous week they had to administer it on, their girlfriend or things like that. I've heard a lot of stories about that.
Pharmacist Phil Pavlench sees patient after patient wanting to get the life-saving drug Naloxone.
Walking out with something that is potentially life-saving for them, life-saving for their loved ones, something that, they don't have to see one of their closest friends pass away in front of them.
But without insurance, it can get expensive.
If you have insurance, it typically will cover a couple of doses of Naloxone a month. If you don't, however, you don't have income or you're low income and no coverage, it's really hard to pay for the two doses is a little over $90.
Columbus City Council and Columbus Public Health are each giving $10,000 to Equitas Health. It'll be used to fund an emergency supply of Naloxone for those who can't afford it or don't have insurance.
When we have a bad weekend, we lose a lot of lives here in the city, and I think a program where more people have access to Naloxone can only improve the health and the well-being of our community.
City Council President Zach Klein says Columbus EMS responds to 5 to 7 calls for Narcan each day.
We have to follow up with treatment. We have to give people the opportunity to get the treatment they need to pull themselves out of the cycle of addiction.
If you've ever had to administer Naloxone to someone, Equitas Health says you should still always call 911. The $20,000 in funding should pay for about 400 doses of Naloxone, which officials say should last at least a few months.